Religious trauma syndrome occurs when an individual struggles with leaving a religion or a set of beliefs that has led to their indoctrination. It often involves the trauma of breaking away from a controlling environment, lifestyle, or religious figure. In some settings, the symptoms of religious trauma can be similar to that of complex post-traumatic stress disorder, CPTSD. What is religious trauma? Religious trauma can stem from spiritual abuse, can impact individuals differently, and can have a devastating effect on someone's self-esteem, sense of self-worth, and identity. Religious trauma can lead to an individual believing that they are inherently bad or condemned, especially if they've experienced purity. What is religious trauma syndrome? Religious trauma syndrome occurs when one is surrounded by a strong community of like-minded individuals who see their religious path as the only way and identify those not in the religion to be bad and misguided. There is a deliberate and intentional effort to be disconnected and set apart from mainstream society and traditions. For some, this can include not observing holidays, going to places like movie theaters, or dressing modestly. For others, this can include living in more rural areas, avoiding the appearance or perception of evil, or attending religious gatherings frequently. Some examples of religious trauma syndrome include: a young woman who finds herself pregnant out of wedlock may be subject to sanctions and be ostracized from the community or congregation. She may feel shame, confusion, guilt, or depression due to religious indoctrination, or believes that she is a bad person. A person may be told that the majority of their financial resources should go to the cause of furthering the message of the religion, causing financial hardship. Because religious trauma can be prevalent in childhood, becoming more distant from religion can sometimes mean that individuals feel that they are abandoning everything that they've been taught. Symptoms of religious trauma include: poor critical thinking skills, difficulty making decisions, decreased sense of self-worth, difficulty building strong relationships, struggling with fitting in and belonging, nightmares, sleeping issues, eating issues, sexual dysfunction, anxiety symptoms, depression symptoms, grief symptoms, loneliness. If you grew up in a religiously abusive organization or community, it can be challenging to break away from those beliefs and traditions. As a result, there can be significant mental and emotional anguish as well as cognitive dissonance between what you have been taught in childhood and what you have learned through research and your own personal exploration. You may find it difficult to trust others or to trust yourself due to experiencing a religious environment that was toxic and/or a faith leader who had manipulative intent, causing betrayal trauma. It's important to keep in mind that some of the symptoms of RTs can overlap with other mental health disorders, which include bipolar disorder, borderline personality disorder, anxiety disorders, or clinical depression. Religious trauma can have an astronomical impact on one's mental health. Growing up with a strict set of standards and beliefs can mean that you are ill-equipped to navigate a society that operates with a different set of rules. Guilt, depression, hopelessness, and fear can be one of the many emotions you experience as you distance yourself from a religiously abusive community or environment. You may experience being ostracized and distanced from a close-knit community and feel the conflicting emotion of being liberated at the same time. If you've experienced religious trauma, here are 7 ways to cope. Recognize that it has occurred. It may be easy to make excuses for your childhood or to think that things were just different. In order to heal from your childhood trauma, you have to recognize that, while your community and your parents may have had good intentions, they were misguided, and it led to you experiencing harm. Separate your personal values from your religious beliefs. Find examples of individuals who do good and are caring who may not subscribe to religious or spiritual beliefs. Write down a list of values that you find important and identify which values are connected to religion. Get connected to healthy supports and community. Get to know individuals that are outside of your religious community. Join a civic organization or a club. Look for ways to connect and belong to a group where the commonality is not religious beliefs. Explore what you believe and why you believe it. Take inventory of what you've been taught to believe and what you know to be true. It's okay to identify areas where you may feel less sure and would like to do more exploration. Create healthy boundaries in relationships. Experiencing religious trauma can mean that you have not experienced healthy boundaries. This means that you have had decisions made for you without your informed consent, and that it may feel unfamiliar to set your own standards for relationships. Identify your hopes for the future. Be intentional about creating a life and experiences for yourself that are outside of what you experienced as a child. Make a bucket list and start taking small steps outside of your comfort zone. Foster relationships with individuals who have different perspectives and backgrounds than you. Seek support through therapy. Finding a therapist can feel like a daunting process, and it may seem unlikely to find a clinician that specializes in religious trauma. However, a trauma-informed therapist that specializes in complex post-traumatic stress disorder, CPTSD, can be a great starting point for getting additional support. The most effective treatment options will, of course, depend on the individual and the type of religious trauma. Know that you're not alone. We are coming to learn that religious trauma is much more pervasive and universal than previously thought. An important tip for someone working to heal from religious trauma is to remember that you're not alone in your pain. The continued experience of trauma later in life is not a reflection of your personal coping skills or your strength to overcome the past. You are not your trauma. Final thoughts on dealing with religious trauma syndrome. The process of leaving a religion can be complicated, and it looks different depending on the individual. You may doubt yourself and doubt that you're doing the right thing. However, connecting with individuals who have had a similar experience, as well as a therapist, is an excellent step in making healthy decisions for your mental and emotional well-being and creating a new future for yourself. Thank you for watching. If you found that this video was helpful and you want to learn more about how to heal from trauma, smash that like button and subscribe. If you are not sure if you are dealing with unresolved trauma, take a free quiz to find out. The quiz is linked down in the description below.